Hello, this is Dr. Nathan Way, and I'm going to be taking you on a guided tour through a stem cell procedure. The very first thing I'm going to bring up is the importance of standardization of the process. Experience obviously is very important, as is consistency. We follow what are called good clinical practices, GCPs, as well as standard operating procedures, SOPs. Those of you who are familiar with the workings of clinical research will recognize these two important criteria. We start by drawing blood in order to obtain platelet-rich plasma, and platelet-rich plasma will furnish most of the growth factors that we use in this procedure. When the patient is taken to our ultrasound suite, we will measure different areas, the target area, as well as the area for harvesting both our fat as well as bone marrow from the iliac crest. And we do this using ultrasound guidance. That way, the harvesting process is exact. There's no guesswork involved. And here's another look at us looking at the target joint, which is going to be the knee, and marking out the different areas that we're going to be focusing on during the course of the procedure. And there are certain things that we can tell from the patient's prior x-rays, MRI scans, as well as the ultrasound examination that give us clues as to where we need to focus our attention. And this is our procedure room. The patient is placed in the prone position for the initial process, which is the harvesting of bone marrow. And we also harvest fat at the same time. We use local anesthesia. There is no general anesthesia involved at all. And this is our trocar that we use to obtain bone marrow from the iliac crest. And because of the markings that we made during ultrasound, our extraction of bone marrow is relatively painless, believe it or not. Here we are drawing up a small amount of bone marrow and finishing out our bone marrow harvesting. The marrow is then collected and process is initiated. We've used different types of machinery at different times, and we have found the arteriocyte system to be the one that we like the best right now, and seems to provide very good numbers of stem cells. Sterile Technique is so important. I can't overemphasize that point. And so we scrub the knee, we cleanse the knee with betadine alcohol, and the knee is prepared as if we are doing an arthroscopy, because we usually do. Again, local anesthetic. There is no general anesthesia involved. Diagnostic ultrasound is helpful in establishing our portals and also guiding instrumentation before we use our arthroscope. And as you can see, my attention is focused on the ultrasound screen in front of me, where we can actually see quite a bit of the surface anatomy. Once we have accomplished all we need to accomplish with ultrasound, it's time to use our arthroscope to evaluate the joint. This is critical in that it allows us to induce injury in the areas where we want the stem cells to eventually go to. So in every joint that is affected by osteoarthritis, there are going to be areas of bare bone where the cartilage has been worn away. And it's those areas where we'll induce injury using a special trocar. And once we've completed everything and know exactly where we need to go, we can then deliver our stem cells, our growth factors, our scaffolding material, and our other materials that help form our solution into a gel directly in the area of concern. And again, oftentimes we'll switch back to using ultrasound guidance during this. And that about wraps it up. It's the end of the tour. For more information, you can contact us at the Arthritis Treatment Center, 71 Thomas Johnson Drive, Frederick, Maryland, 21702, and by phone 301-694-5800, and on the internet at www.arthritistreatmentcenter.com. Thanks for watching.